Hi guys, it's Monique LeClaire, your DCMG clinic coordinator at Strictly. Doing something a little different today. I know I always send lengthy emails that some of you may or may not read or overlook. So I thought I'd do a video because it's more fun and interactive. So I put on this cute outfit for you guys, and you can see some of Nova's artwork here in the background. But anyways, I just want to talk about a few updates because I know a lot of you can no longer get to the clinical oversight committee meetings every month because we changed them to Tuesdays. So just a couple of quick updates for everyone. The first 3 weeks of November are going to be competency sign-offs. So I need all of the clinic leads, nurses, and MAs to sign up on the sign-up sheet I sent out so that we can get all that stuff done. So basically, for those of you who aren't super familiar with it, this is my first year doing it, but what's going to happen is each nurse or clinic lead is going to come from each clinic. They're going to get signed off on competencies, vital signs, things that are needed to do your job at your clinic. And then what that lead is going to do is go back to their clinic and sign off the rest of their employees, scan those forms to me, and we put them in the system and we're good for the year. Okay? The second thing I want to talk about is crash carts. I've been coming around. I went to a few places yesterday. I want to give a huge shout out to ophthalmology at Far West. They had an exceptional crash cart. They had extra stuff in there. Nothing was expired. It was well stocked. They had backup oxygen tanks. Everything was beautiful. So they won a pizza party. So also ENT at Davis Lane had a really excellent crash cart. And where else did I go? I've been going to a lot of places. Everybody has had really great crash cart. Oh, infectious disease at Strictly. They had a really great crash cart. And so yes, the point of this is so that we can prepare and make sure that we have things necessary to do our job in the event of an emergency. Even though we don't always anticipate emergencies, they happen. We had one happen recently at one of our clinics, and there were some questions raised by our physicians about preparation. So in addition to checking the crash carts for this month, this week, which I might continue to do also in November, we're having emergency preparedness month in January. So I'm going to be going around to all the clinics. We're going to have mock codes. I'm not going to tell you when I'm coming. We're going to have active shooter training run-throughs. Just some things to keep us prepared in the event of an emergency. I wanted you guys to know, I took some notes. I really would like if all of our crash carts could have, be preferably near the AED, have oxygen near them. I'd like to see a Yankar on top of the suction canister because in the event of an emergency, our biggest thing is going to be ABCs, airway, breathing, circulation. We're going to be maintaining the airway while we wait for 911 and emergency services to arrive. So we're waiting for the ambulance. They're not breathing. They're unresponsive. We're bagging. We're maintaining our airway. We're making sure that patient or family member is perfusing oxygen to their brain and their vital organs. So always, always, always want to make sure if we need to clear the airway, we don't have to dig or unlock a box or run around. The Yankar's right there on the suction. You pop it open, you hook it up, and it's good to go. The second thing is I'd like to see ambu bags. Ambu bags, nasal cannulas are great to have, but in the event of a true emergency where someone's hypoxic, a nasal cannula is not going to be sufficient, especially if they're not breathing. We need to bag that patient. So infant, pediatric, and adult ambu bags, one of each size is fine, hanging on the oxygen. So all you have to do is rip that bag open, plug it in, take the oxygen to the patient, and start bagging them. That's the goal. The other thing is Broslo tape. For some of our crash carts, I've seen some Broslo tape with them, and I really like that because you really, if you're going to be medicating during ALS or ACLS, with a physician, and you may or may not have had time to get the patient's weight, pull that tape out and you can dose your medications and stuff right there. So yeah, that's pretty much all that I have. I've seen, okay, also please, before you order anything, email me, call me. I have so much stuff. I picked up a box of saline bullets from one of our Far West clinics and delivered them to one of our Med Parkway clinics yesterday because they had some expired ones and didn't want to order a whole new box, so I just delivered them and saved them a whole bunch of trouble. And so yes, I have lots of syringes, needles. I have pediatric ambu bags, some non-rebreathers, I believe. So before you guys order anything, just reach out to me, and I look forward to seeing you soon. Oh, aspirin, 81 milligram tablets. I have a box of the packets. So a lot of you guys are ordering the big bottles of aspirin for your crash carts. You can stop doing that. I have a whole box of the individual packets, 81 milligrams, 324 is all you need for someone who is an adult who's having chest pain. They're gonna get 324 of chewable aspirin. So you just need to have 4 of the 81 milligram aspirin really stocked in the crash cart. You need a whole bottle because it's not gonna get used. It's gonna get wasted. Okay, anyways, that's all I have for you guys. Have a great week. I'll see you soon. Bye.